This is Carrie Manaki, and this is my final project for the HIMT program. Testing, 1, 2, testing, testing. Testing, 1, 2, testing. Testing, 1, 2, testing. Testing, 1, 2, testing. This is Carrie Manaki, and this is my final project for the HIMT program. This is Carrie Manaki, and this is my final project. This presentation goes through 4 different categories that were addressed in the portfolio. The first one is the interview. My name is Carrie Manaki, and this is my final project for the healthcare practicum. In this presentation, I addressed 4 different aspects of the portfolio that we were assigned to do. In the first part, I interviewed Kimberly Colum. For the first part of this project, I had the wonderful opportunity to interview Ms. Kimberly Coleman. She is a certified coding specialist and an OASIS coordinator for United Home Care of Griffin. For the first part of this project, I had the pleasure of interviewing Ms. Kimberly Coleman, who is an OASIS coordinator and certified coding specialist for United Home Care of Griffin. Kimberly received her associate's in health information technology from Kaplan University, and she also went on to get a bachelor's degree in nursing from Clayton State College. She has been a certified coding specialist for 8 years. She worked as a billing and coding specialist in a small medical practice while getting her BSN. After working as a home health nurse for a few years, the first part of this project was the interview with Ms. Kimberly Coleman. Kimberly is an OASIS coordinator and certified coding specialist for United Home Care of Griffin. Kim started her career by obtaining her associate's in health information technology from Kaplan University and then getting her bachelor's degree in nursing from Clayton State College. She is a certified coding specialist, and she has been for 8 years. She worked as a billing and coding specialist in a small medical practice while getting her BSN. After working as a home health nurse for a few years, she wanted to move into more of an administrative role. So she decided to come back to home health in an administrative aspect. As an OASIS coordinator for United Home Care, her job functions include providing guidance to nursing staff and therapists for OASIS compliance, proper ICD-9 coding, and plan of care compliance to meet Medicare regulations and standards, assisting with quality assurance activities, and development of quality improvement plans, providing clinical staff training, performing clinical record audits, and maintaining and upgrading professional knowledge and practice skills through attendance and participation in continuing education and in-services. Just to give you a little more information on Ms. Coleman, she feels that the health information management field is a necessity to improving overall patient care. There is more accountability in patient records, and all of the patient's information is more easily accessible. She will have to take her ICD-10 exam, which will give her a dual coding certification. One thing that she is excited about, though, in the ICD-10 system is the increase in specificity of codes, which allows more information to be conveyed in the codes. This will affect her position because there will be a need to be more diligent and precise in her coding of patient OASIS in order to yield the needed reimbursement from Medicare. The next step in the project was to attend an AHIMA event. I had The next part of the project was to attend an HIMA event, and I had the luxury of being a part of a webinar hosted. The next part of the project was to attend an HIMA or just HIMA event. I chose to be a part of this webinar, which talked about how you could use the delay of ICD-10 implementation to your advantage. The speaker was very, very interesting and had several main points in her webinar, but the three that really stood out to me were the ones that are here listed on this slide. The benefits of utilizing CAC, which is computer-assisted coding, which is something that is available now in coding programs that will get even more in depth with the ICD-10. But basically, the benefits of utilizing these systems are they increase productivity and efficiency in coders, they increase coding consistency, there is potential for more comprehensive code assignments, and trends in problem coding can be found quicker with the CAC program. Another thing is the dual coding. Dual coding certification is when a coder is certified in ICD-9 and ICD-10. Concurrent coding is one coder coding both ICD-9 and ICD-10 codes per chart. In double coding, a coder codes every visit in both ICD-9 and ICD-10, and it depends on the practice that your facility is, where they are in their process as to the steps that will be taken. Another thing is ICD-10 increases focus on coding accuracy. So with the codes being more specific, they describe more of the patient's medical issues. There was a need for ICD-10 because the ICD-9 system is outdated because it was implemented in 1979 and was not meant to be a long-term, system. So they were talking about upgrading to ICD-10 long before they actually did it. So this delay, putting us into 2015 before it's implemented, is not really that much of a wait if you consider it. One of the main things that we in this program will do when we graduate is take the RIT exam. The RIT exam is the state certification for Registered Health Information Technology majors. My area of strength in the RIT competency is medical billing and reimbursement. And this is true because I worked as a Medicare Medicaid hospice biller for 6 months and had extensive on-the-job training. I was fortunate enough to be presented with this opportunity without much billing experience and to gain vast amounts of knowledge in this area. So this part of the exam will be easy for me versus other aspects of it. My weakness in this would be, honestly, the ICD-10 coding. It is something that I'm trying to improve upon, that I've studied to improve upon, but sometimes it's a bit difficult. My plan to increase my aptitude for coding is to go through the coding manual and study extensively before I take the RIT exam. I am also going to utilize the help of the CCS at my job. Another aspect that I have thought about implementing is to see if there are any coding crash courses that could help me pick up some things that I've missed along the way to be better at what I'm doing. Overall, the Health Information Technology program has been a wonderful experience, something I will take with me and utilize always. But there were some things that really stood out for me in this semester. I would have to say my favorite part of the HIT program would have to be the prerequisite anatomy classes. Having the opportunity to learn the body systems gave me clarification and more understanding of patient health records. We also had the opportunity to see the body systems up close when we had the opportunity to dissect several specimens. These classes actually gave me the inspiration to further my clinical education after completing the RHIT program. Being exposed to these aspects of the program made things more real for me. When you are studying about something in a book versus seeing it up close, Now, I'm a visual and a tactile learner, so to be able to see and take my hands on, and it really helps things to sink in. It helps me to learn. The area I feel could be improved would be the coding classes. Although we were given wonderfully detailed instruction, I was still not at my best in this category. I was never able to be a part of the live sessions because they were held during the day while I was at work. So if a nice class could possibly be implemented going forward for the next group, it might be beneficial. But overall, I enjoyed the program. I'm very grateful to have been a part of it. Southern Crescent's a wonderful school, and I'm just happy that I'm here. So thank you very much for your time.